Get started. I'm Quinton Lucas, the mayor of Kansas City. We wanted to share a few details today with you about an extension of our stay-at-home order. We'll have an opportunity for questions at the end of our time. As we announced earlier this morning, Kansas City, Missouri will extend its current stay-at-home order in effect until April 24th, until May the 15th. There are several different reasons for us doing so. I'll describe some of it, but other context will be provided by Dr. Rex Archer, our Director of Public Health, who has been with Kansas City since 1998, and Dr. Erica Carney, our Director of Emergency Medical Services. We listen to advice, and we listen to health advice. This is not an issue of, in my opinion, politics. It's not an issue about any other kind of ancillary concerns. It's about how we can keep people safe. And the advice that we've received, not just from Dr. Archer, not just from Dr. Carney, not just from the health directors of 9 counties in western Missouri and eastern Kansas, but from largely the lion's share of everyone in the medical field, is that we need to make sure that although we have taken key and important steps to flatten the curve, that we need to take more steps to make sure our community is safe, to make sure that we do not see a rapid increase in reinfections, and to make sure that we can actually do a better job of reopening our economy. We all recognize it does us no good if we go through all these steps now, and then in June, in July, in August, we're saying that because we reopened too quickly, we have to actually go back to some of the very steps that we've taken now. And so that's why we're going through, in my opinion, the very important work to make sure that we are ready and that we're prepared in this situation. That's going to be our key role and our key task. There may be any number of questions that you also have, which is, for example, why are we using our deadline and our date for this order as compared to a May 3rd deadline that you've seen in a few other situations? We recognize that yesterday Governor Kelly of Kansas announced May 3rd. We are hearing indications that Governor Parson of Missouri will also look at May 3rd. The answer is a very simple one, I think, for Kansas City, which is that the situation in Kansas City right now is in many ways different than perhaps what's being seen in a place like Fulton, Missouri, or in a place like Hutchinson, Kansas. Right now in the Kansas City area, we have 1,571 cases. We've already had 81 deaths in the Kansas City metropolitan area. In Kansas City, Missouri alone, we have 371 cases. We've experienced 12 deaths. As has already been reported, those deaths have largely impacted communities in disproportionate ways. Those deaths have had an impact in different areas of our city, different regions of our city, and different regions of our entire metropolitan area. It is not enough for us to say that we've made strides, because we truly have made strides over time. But I think what we need to make sure is to say that we are taking enough important steps to make sure that our community will stay safe long term. And I know, as someone who spoke to a family that lost someone this week, a Kansas City, Missouri paramedic, I'm not comfortable just saying that we should reopen when that may lead to someone's loss of life. Ask if you want that to be your mother, your father, your cousin, your brother, your spouse. So we're going to make sure that we continue to take those key public health and public safety steps. And that's preeminent. And that is our primary goal. And that is our primary focus in every step that we're taking in Kansas City, Missouri. I'm going to go through a few questions that I've already received. I'll then have I'll have our doctors speak briefly. I'll come back and answer questions for you. There are some that have asked, why aren't we going earlier in terms of pulling off these orders at some time faster? And I think in some ways we've already answered and addressed that point. But we want to make sure that we don't see the sorts of spikes at some point that we've already seen in places like Detroit, places like New Orleans, frankly what we're seeing right now in the St. Louis metropolitan area. St. Louis, which is a metro that only has 700,000 more people, has a dramatic outbreak in cases. Today, the county executive in St. Louis has announced that they're going to have an indefinite order. Indeed, the mayor of St. Louis has said the same. So for some who would say, how are we inconsistent or consistent with Missouri? This morning, there are 1.5 million Missourians that will have an order that may likely extend long beyond our own. We think that this is a good and moderate approach for us to try to make sure we're addressing these issues. The other thing that we have to recognize is that this is not just an issue of a few weeks. This is something that we may be dealing with for months and years. What we need to make sure we do is to take the time to look at what reopening really means. It doesn't just mean that we say that, on May 3rd, right, things are going to end, we're going to open back up, and there's going to be a baseball game we all attend at Kauffman Stadium on May 4th right after. In fact, that's very unlikely. This is giving us that time to work with our public health professionals, to work with our economic development professionals, work with law enforcement, public safety, fire, paramedics, and so many more, to make sure that we are ready for what reopening looks like. Looking at rules relating to capacity in buildings, looking at rules about how can we introduce better social distancing, better mask wearing in grocery stores and so many other areas and so many places of our daily life. There are some who've also asked, what does this mean to business in Kansas City? And frankly, this is something that I have thought about nonstop since we first issued orders. It is still a point of pride for me that Kansas City, Missouri is the first jurisdiction in this region, and I believe to this point, the only jurisdiction that has appropriated funding to help support small businesses. That was not an accidental step. Before I introduced my first stay-at-home emergency order, I had a call with regional leadership about the need to make sure that we're supporting business in Kansas City and we're supporting business throughout the region. Because I recognize that it is not enough for us to say that we need folks to stay home. We also need to let people know not only how we can help them survive now, but more importantly, how we can help them rebuild into the future. How we can say that local government is there to work with you. Local government will not leave you alone. And frankly, we're going to make sure that we are all in this together as we look to reopen and to rebuild our economy in Kansas City, in our entire region, and hopefully in our entire country. As part of that, I do want to commend, and I've already talked today to Senator Josh Hawley of Missouri, who I know President Trump has appointed to a committee in connection with reopening America. I think it will be important for all of us, Democrats, Republicans, to work together as we look to reopen, as we look to address our public health concerns. And as part of that, I will note that I've had conversations not just with Senator Hawley. I talked to Senator Roy Blunt yesterday. I talked to Governor Parson for roughly 17 minutes last night. It's because we're all in this together. We're all trying to figure out how Kansas Cityans, how Missourians, how people in Missouri and Kansas, frankly, can stay safe. This morning, I talked to mayors from throughout western Missouri about this order, and many of them said, and have already started taking those steps. You've already seen the City of Independence has issued this order. Last night, I talked to leaders from Johnson County, Kansas, Wyandotte County, Kansas, Jackson County, Missouri, about these very orders as well. So it is my expectation that we will see this broadly be the approach throughout our region. It's the right approach. It's the smart approach. It's an approach that's based on medicine. It's based on science. It's based on what's necessary to keep our community, to keep our citizens safe. A few other things. Some people may ask, is this indefinite? What do extensions look like? The reason we're having a conversation today about May 15th and not a conversation about May 3rd is because I wanted to be honest with the people of Kansas City and with the people of this region. I think it's fair for us to say, well, maybe we'll do May 3rd and then we'll come back in a few weeks and tell you 2 more weeks. Then we'll come back 2 weeks later and tell you 2 more weeks after that. Now, certainly, if conditions change, if things get more troubling, if things get more trying, then we'll have to look at extensions. But what we're saying, and what our medical experts are telling us, is that May 15th allows us to look at the time when we expect a spike to occur in this region, which is the end of April, and allows for a 14-day plus period for an incubation period thereafter. What that means is that we get to mid-May as our point at which we're in a position to say that we can look to what reopening looks like for us. What I did not want to say was, we'll just go May 3rd as a matter of political compromise, and then, shucks, maybe we'll all come back later. I know Kansas Cityans want to see the light at the end of the tunnel. I think today in Kansas City, Missouri, we're announcing what that light at the end of the tunnel looks like. It looks like a realistic date that's based on medicine, that's based on science. It relates to the fact that we work with parties from all sectors to see what reopening looks like, to see what addressing public health issues look like. It means that we're working with folks throughout our region. That's why I'm proud that today the Kansas City Area Development Council, the Kansas City Chamber, and the Civic Council of Greater Kansas City have applauded our efforts today to extend the order to May 15th. A few other points, and then I promise you I'll get out of the way. One is, what are we looking to in terms of making sure we address economic development long term? I've already spoken to the $500,000 that Kansas City, Missouri is doing in small business emergency relief. We'll look to find even more in Kansas City's budget. We'll look to encourage more from the nonprofit sector as well. But we also recognize that we need to work with a number of our social service agencies in Kansas City. I know actually a number of folks in our media today are helping us raise money to support a number of nonprofits. I've been working on that, working with groups like AIDS Walk of Greater Kansas City, working with our homeless shelters and so many more that are taking care of at-risk populations now and making sure that we have treatment long-term. And then one other point that I want to ask is this, and I know this is one that is primarily asked often from folks, and it is, how do we open back up? What are some of the metrics that we look at? And Drs. Archer and Drs. Carney may spend more time on this, but what we look at is this. Are we seeing a decline in cases for a sustained period of time? A decline in cases for a sustained period of time. The answer right now is no. Do we have appropriate and sufficient healthcare capacity? Currently, yes. But the idea is that we don't want to jeopardize it by opening up too soon. And then there's the question of, is there widespread testing available for us so that we can identify a surge in cases when we do loosen those restrictions? I'll look to what the governor of Missouri had to say yesterday. He noted that the state of Missouri probably needs about 40 to 50,000 tests a day to fully reopen safely. Right now, the state of Missouri has 3,000. So we're about 37,000 short right now in Missouri to match our testing goals. To me, that suggests that we need to continue to take our other steps. And that's the sort of work that we want to do. We also want to make sure that we're helping our public health agencies and our Kansas City Health Department that is doing an amazing job, but that's still having trouble making sure that they can trace folks and make sure that we're tracking enough of the cases now. So we understand the need. We understand that folks want Kansas City, want this region to be open soon. I care about it. I'm passionate about it as well. And indeed, our revenues are based on business and activity in our region. But we also understand that these are the important steps we have to take to keep our communities safe. And I note that I had some folks reach out to me today, and I happen to hop on social media sometimes, and they say, well, Lucas, you know, you're going to save a few lives, but you're going to devastate something else. You're going to devastate an economy. And I say, well, you know what? I think that's a tough balance. Whose mother, whose father, whose brother, whose sister do we sacrifice because we open up too soon? And that's why these steps are so important for all of us. With that, I'll come back for questions, but I want to allow Dr. Archer, our health director, to make a few comments, followed by Dr. Carney.
Thank you, Mayor. All of you are hearing the concerns out, either people that are afraid to go out because of the virus, or the people that are afraid they won't have their money to be able to pay their rent. This is not an easy issue. But I'm going to be one of the first to make it very clear that we wouldn't even have to be here if we learned from the 2003 SARS outbreak. South Korea had its first case the same day we had our first case in this country. But they had the testing capability, the contact tracing capability, because they had developed that. They had taken the SARS outbreak seriously. We didn't in this country. We lost basically half of our public health workforce over the last 10 years. So the problem is, to open up when we still have cases means we will have outbreaks and fires. We will have multiple folks not only dying in nursing homes. We've had 2 30-year-olds out of our 12 deaths here in Kansas City, Missouri, and one of those 30-year-olds had no pre-existing conditions. So this isn't just a disease that kills 60, 70, 80, and 90-year-olds. It can kill people in middle age also. Now, my concern is that until we have the ability to test all contacts of positive cases, so the way we stop an outbreak in public health is what we call a ring around a ring. And you start off with boxing it in so that you have a positive test. Everybody exposed to that test then needs to be not just quarantined, but they need to be tested at least twice. They need to be tested early in the incubation period and then before you release them off of quarantine. We don't have that capacity now, so that means it'll break out. We also don't have the capacity yet to be screening the high-risk folks. We need probably at least several hundred tests a day moving around to different grocery stores, to long-term care facilities, to various EMS healthcare workers, so that we're checking to see if the disease is there, because this is the real problem with this disease. It's very different than Ebola or smallpox. If you get the disease, everybody knows you got it, and you can stop the outbreak easily. With this disease, some of you probably already have it and don't know you have it, and you're spreading it to other folks. That's why wearing the mask is important. It's not just to protect you, but the main reason I'm wanting people to wear masks is so that if you have this, you need to pretend as if you have it so you're not spreading it to other people. The sooner we do this, the sooner we can get our economy back up and running. But I just have to say, and it's that I told you so, we've been talking about this for 20 years. If we had spent even 1/10 of the damage that's occurred to our economy already right now over the last 10 years, we wouldn't have this disaster. And it's been both parties. I'm not talking about any politics. This has been a disaster, and we've got to get it fixed, and we're working on it. We need all of your help to help people stay at home. The sooner that we can slow this down, the sooner we can open back up and not have to close again. But most of us are saying we're going to have to close down at least 3 or 4 more times over the next 24 months if we do this well. If we don't do it well, it'll be more often than that, and for much worse close downs than what we've had so far.
Thank you, Mayor, and thank you, Dr. Archer. This is a marathon, so we are in this for the long haul, and what the end of this looks like, none of us know. So I agree with the extension of the stay-at-home order. I can tell you, after working in our Level 1 Trauma Center emergency department last night, it was the busiest shift I've had in a few weeks. I can tell people are getting antsy, they're wanting to leave their houses, but I discharged about 95% of them. Most of these people, again, don't need to be in the emergency room. They don't need to be calling 911. Recommendations remain the same. If you can stay at home and call a primary care physician, and that is what we appreciate. That's what will help determine if we will become the next Detroit or the next New York. Again, this disease is here. We have patients in the hospital with this disease. And if we can stay at home for the next few weeks, that can really define what we look like at the end of this. So if we do not want to look like Detroit, we do not want to look like New York, then I agree with what Mayor and Dr. Archer have said. We need to continue the stay-at-home order.
All right. I will take any questions from you. I will just go in order like last time. Ms. Kite?
Governor Kelly yesterday said some level of social distancing steps might be necessary until a vaccine is ready. Dr. Archer kind of touched on this, but can you take a picture of what life for the next 18, 24 months might look like as opposed to, these 3 weeks?
I think in terms of social distancing, and I'll try to take a whole set of questions, and then afterwards we'll just go in that sort of order. What we are largely hearing from our advisors and others is that we will look to introduce more social distancing in how we do any number of things, right? How businesses reopen, how we look to even handle out in the entertainment business. I will note actually that Dr. Archer was one of, I think, our earliest experts in this part of the region, the country, who was speaking to the fact that we need to look to percentage capacity in a number of stores and other establishments to frankly support our social distancing efforts. If you still have the same capacity in a business, it's likely that you will have more crowds, those sorts of things. And so I think as we look at that next phase of what our restrictions look like, particularly as we talk about easing up restrictions, we will continue to see some amount of emphasis on our social distancing rules, how we can keep those as part of what our new normal really looks like. Yes, ma'am.
So what would you say to the people that
I think much of what we have already said is our response. First, we care deeply about this. Throughout the entirety of this crisis, we have dealt with the fact that we knew it would have a big impact on business. None of these decisions are made lightly. All of these decisions are made with an emphasis on public health. And frankly, all of these decisions are made with an emphasis on the fact that public health and our economic health and safety aren't separate. We need to be a healthy and stronger society, and that makes us actually economically stronger. If you do not actually have an opportunity for folks to be healthy at work, for customers who feel safe going to establishments, then we can't get back. And so we need to take these steps to make sure we don't have a rapid outbreak once again, to make sure that if we open up our convention business, our Sprint Center that I can see from here, so many others, that people would actually go there. So we need to make sure that we're taking those key and important steps to make sure that our region is healthy and safe. And I think so far, the steps we've taken, and I want to say that to every Kansas City, and frankly, every person watching in Missouri and Kansas, we have done outstanding work to help flatten the curve. It's been exceptional. I am so happy, and in many ways, I feel lucky, and I say there, but for the grace of God go I, or I say there, but for the grace of God go we. And the fact that when I look at metropolitan areas like New Orleans that has fewer people, or Detroit that has more, but it's also Midwestern, and I see the challenges that they're confronting, that we're not there. And so I think when we talk about how we have true economic recovery, it's making sure that we allow for the public health recovery first, which is going to be the key part of what we do, and then doing everything we can in local government to make sure that we're finding funding support, to find business help support, nonprofit support, what we're doing in Kansas City government to make sure we're addressing all these issues. Michael?
Mayor, is there anybody left in Kansas City, Missouri fund that is still taking applications?
So we continue to take applications. I know that certainly, so there are different funds. The off-cap fund actually had announced before us privately, and that fund, I believe, received tens of millions of dollars of applications and had far less to give. For Kansas City's fund, we're actually still going through the process of taking in requests. We've already had them, but that will get expended quite quickly.
Money there now?
There's money there now.
Hey, what is the sign that basically what are the hard facts that you're basing this on?
I will let doctors answer. I'll just go with what I understand. And one of those was, first of all, that we continue to have infections, right? And we continue to, we're looking for a sustained decline in infections, not a one-day blip, not a two-day blip, something that is sustained that can tell us that we are in a position to actually measure that we're in a much better place than we were before. And for our estimates, and the estimates that I've seen consistently, and the estimates that I know I've heard not just from our health directors, but from physicians at hospitals, from health directors of hospitals, is that we are continuing to expect a spike that will be at the end of the month of April. I think the state of Missouri has a new number out that I saw for the first time, I believe, yesterday, that suggested a spike already happened in Missouri. But I tell you, on the ground in Kansas City, in Jackson County, in western Missouri, I don't think that's what we're seeing. And Lord knows, every conversation I've had with Lloyd Cruson in St. Louis, or everything I've heard from Sam Page in St. Louis County, that's not the case there. So in urban and suburban areas of Missouri, we're seeing that the data suggests for us we need to continue, and we need to continue because the spike hasn't occurred yet. And frankly, that we need to continue to make sure that we're looking further out to make sure people are safe and protected. But I know our medical experts will get to that after for you as well. Yes, sir.
Mayor, I just want to start with the owner of the restaurant. And he asked, he wanted me to ask you, how long would it take, how much do you believe the business could survive under this situation? Also, he asked, how long do you really think this is going to go on?
So there's a reason that we're out here talking about May 15th right now, because it is fully my expectation that as we look at things, we will understand that there will be a gradual change to what these orders look like. So in Protestants, I would say, how long will this go on? Maybe quite some time. But how long will this level of a stay-at-home, which is really close to a shelter-in-place stay? I would hope not long after May 15th. I would hope that we actually have the time to look as a government, as folks who work with businesses, as folks who work with medical experts, to see we are actually in a point where we can change what the orders look like. And for anyone who's in business, look, I talk to business people every day. It is not lost on me in the same way that it's not lost on the Kansas City Chamber of Commerce, that it's not lost on business leadership from throughout this region, that we have important work to do to make sure that businesses can survive this period. We're trying to make sure that we give them quicker access to stimulus funds. I actually to give you some news, I spent some time this morning talking to the Missouri State Treasurer about how much faster can we get funds that will be coming to all of us in Western Missouri faster. That's the work that I have folks in Jefferson City doing today. And so we're doing everything we can from a local government perspective, everything we can working with our state and federal leadership to make sure that we're getting those funds as soon as possible, understanding that this is a tough time for businesses in Kansas City and in our area.
I'm going to go right back to the small business question.
Yeah.
The alt-cap fund ran out of money at about noon the day it was released. The PPP funds announced this morning that they were out of funds. What is the city prepared to do, and how much are you prepared to help subsidize those small businesses that are struggling right now with additional funds?
So we're taking every step we can to first find more money. One of the challenges is that we run out sometimes too. I think the other step that we're trying to take is to make sure that we're working with area nonprofits and philanthropic organizations to make sure that there's significant support. When I had some interest in creating a fund, part of that interest was in the fact that we were going to talk to a number of our foundations, talk to a number of folks to make sure that there was adequate funding to help address our issues here. So look, we know there's not a never-ending reservoir of funding. We're going to try to make sure we address it, but I also understand that there's more work for us to do ahead. Yes?
Mayor, with this extension and the loss of sales tax revenue change in the city and other revenue change in the city, have we taken a look at how this impacts the city's budget?
We know that there will be a significant impact on the city budget. I've been talking to our fire department. I've been talking to a number of others in connection with how we can handle it. We know it'll be significant. We know we need to make changes. That's why we've already announced a hiring freeze. That's why we're taking every opportunity to try to address these funding issues long term at City Hall. Dr. Archer may answer more. I'll come back at the end.
So Mike, on your question, think about our modeling, the various ones we've looked at. And we've talked with our hospitals, we've looked at our own data. And if at the end of April, plus or minus a couple days, that's our peak, that doesn't mean that May 3rd, everything's hunky-dory. In SARS outbreak in Toronto, they actually completed their whole peak, declared the outbreak over, and then had a resurgence of about 2/3 as many deaths in the second wave. Now, how we balance this against the real concerns of people that are unemployed now, businesses are failing, those have health consequences too, and we're starting to look at the modeling of that to find where we can best handle this. What we have to have is not just our overall rates drop, but they have to be dropping in the groups that are the most disadvantaged, that have the least ability to protect themselves. If you look at, white males that are college educated, an awful lot of them can work from home and still get a paycheck. Folks that are high school degrees that are working in certain labor situations, they can't work from home, and in many of those cases they don't even get sick leave, so they can't make the rent pay. But we've got to deal with that situation. If you're in a home where you've got multiple bathrooms, if one of your members in the household becomes infected, you still have a chance of keeping that from spreading within the household. But in crowded conditions, that's not the case. So these are the things that we're factoring in. I definitely feel that after the 15th, if all of our modeling and projections turn out to be true, we'll be able to start easing some of these, but we're going to have to probably look at it at every 3 to 4 week cycle of, can we keep dropping the bar on the social distancing without having major outbreaks. Now, if we get the staff on board and we get the testing ability, we can handle some things because we can ring around them and get them stopped fast. We didn't have, with Ebola, we didn't have the economy collapse because we were able to manage that at that time, but it's a different disease.
Doctor, when you and the other health directors made this recommendation, published it last night, was it based on local information? Was it based on regional information? What were the stats that recommendation was based upon?
It's based on all of that. We looked at what's happened across the country when things aren't going well. We're several weeks behind St. Louis on our outbreak. Now, luckily, we put our measures in earlier than St. Louis, so we're hoping that that flattens that curve more and we don't hit as high a peak as the St. Louis area hit. But, I mean, as an example, the last I looked, there were 53 deaths yesterday, I think, in St. Louis County, which is twice the size of Kansas City, Missouri, and we have 12 deaths here. But before we get too confident with that, as I said, we're a couple weeks behind, so I really have to look at what's my number now compared to what their number was 1 or 2 weeks ago, and that's what's bothering us still with this outbreak.
Was it local data again, sir? I'm sorry, I'm unclear on your answer.
I said we looked at both. Yes, I looked at my own local data. The different directors talked about where we are. Also remember, it's not just the cases we have, it's our ability to test and find cases and stop that next wave of the spread. And none of us are at that place yet. We're hoping by the 15th that we can be in better place.
Johnson and Wyandotte counties are announcing a May 3rd extension based on an earlier statewide peak in Kansas. What do you think about those two different dates for a possible lift in the Kansas City area?
Well, Johnson County did appear to get their outbreak a little bit earlier than we did. And I think this is the other thing to differentiate between governors and cities. Governors are looking at the entire state, and I was a health director for 8 years in a 28,000 population, 660 square mile county, twice the size of Kansas City. They already had social distancing just because of the rural nature, so we may not need to have the same level of social distancing across the whole state. Always cities have a bigger problem with any communicable disease. It takes off faster, it's harder to control. Thank God the crowding that New York City has. Can you imagine trying to social distance when you have to wait 2 hours to get on an elevator because you can't all get on the elevator at the same time to get to your apartment? It's a different dynamic there. Luckily, we don't have that level of crowding, but we do have places in the city where we have an awful lot of folks living on top of each other, and if we get an outbreak in one of those, it isn't going to be easy to stop.
Any other questions for you?
Mayor,
Yeah.
there has been an increase in domestic violence cases since the stay-at-home order. Many advocates feel that victims are trapped and isolated. Any thoughts on this? How do public officials balance that safety concern with the health concern?
There's absolutely a public safety issue that we've seen over this time. Not only have we seen a domestic violence increase, we've continued to see a consistent number of shootings. Homicides, I thought, might have dropped from March 2019 to 2020. Instead, they increased ever so slightly. And so it tells us a few things that are going on. First, on the domestic violence point, we recognize that both in domestic violence issues, child abuse, where we've seen calls down, which is also actually a troubling metric, that we continue to have a concern with needing to address issues that are occurring in the homes. That's why we have tried to make sure that our police continue to be fully staffed. That's why we're trying to make sure that we're continuing to invest in follow-up, not just of investigations with domestic violence incidents, but also, and I talked to an assistant prosecutor in Jackson County about in the child abuse realm, making sure that case managers and others are actually looking into situations now, and in some ways checking up at times that they might not have otherwise done. It's hard to go into homes sometimes if you don't know that a crime has been committed, but we certainly know that those who either are subject to orders already are ones that we should be watching more closely now. And I think we're having all of our law enforcement agencies try to work towards that. But it's not lost on us that there are detrimental public safety impacts, just like their economic impacts, but we also recognize that we do need to address our core health issue at Barr.
Mayor, how worried are you that the stay-at-home orders now break down and there are different dates? May 3rd, some places, 15th, somewhere else. How much does that complicate the ability of continuing to combat the COVID?
I'm confident that if you are a responsible local government official in the Kansas City area, then you will have May 15th as your date. The reason I'll just finish that point, then I'll get to your other point. The reason I'm confident of that is that these aren't ideas by Quinton Lucas or Rex Archer. These are endorsements from the Johnson County Health Director, the Wyandotte County Health Director, health directors from Cass County, health directors from all throughout the region. And so that's where we're coming at this metric from. Now, to the extent they don't, we're going to do what's best for our community. I think it's best for our community that the whole region stand together. I'm not going to sacrifice public health of Kansas City, particularly when you have things like outbreaks in my home district, the 3rd District of Kansas City, just because something isn't followed, let's say, an hour away. We recognize right now that there were differences in our order not long ago. Michael, you could have been in Lexington, Missouri a few weeks ago and still gone to a bar and driven right over to Jackson County and lived in a different. We understand that there are lines and that's how they go, but we'll certainly try to encourage to everyone that this is the responsible choice to make.
So you think Wyandotte and Johnson counties are choice by choosing?
No, I didn't say that. I said that it's more prospective. What I'm saying is I think the responsible choice is the responsible choice we took. And if you actually think about it logically, that makes sense, right? That's the reason we made this decision. We think that looking at the information in the Kansas City area, this is the responsible choice to make. Some may make different ones. I'm not elected to run anywhere other than here. And so I'm not going to second guess Governor Parsons' choice. I won't second guess somebody else's choice anywhere else. I'll just say that looking at the advice that I've received from this metropolitan region and from experts in this region, that this is the best option for us. So
You got a hodgepodge. You got a hodgepodge here. It's not speaking from one voice.
I think that simply what I would say to that is we're making a decision that's in the best interest of Kansas Cityans, and I think that's in the best interest of the region. To the extent that we have differences in your viewing area, I imagine there might be several. We'll try to at least recommend to them that this is the right way to go, and we hope they follow it. To the extent they don't, I think we'll all be able to handle that too, but we'll make sure that Kansas City is safe. With that, I think we're good. I appreciate y'all.